Hello everyone, this is Dr. Alfian Stanley, clinical pharmacologist from Chennai. So in this 1 minute CME series on benfotiamine, we are going to see about benfotiamine in diabetes and dyslipidemia. So dyslipidemia is one of the major risk factors for cardiovascular complications in diabetic individuals. An Indian study which has reported the prevalence of dyslipidemia in type 2 diabetes mellitus is almost 63% to 86% of the individuals. So it is a very significant amount. So the risk of dyslipidemia and cardiovascular complication is more with type 2 diabetes mellitus patients. The characteristic features of diabetic dyslipidemia is there is increased plasma triglyceride, reduced HDL and increased LDL cholesterol particles, and the major contributing factor for this diabetic dyslipidemia is insulin resistance. So there are clinical and preclinical research works which were done. So there is a study which was done in animal model of type 2 diabetes mellitus where they were assessing the anti-diabetic effects of benfotiamine. So where they have found out that benfotiamine is helpful by restoring the insulin sensitivity. So which is the major risk factor. The insulin resistance is a major risk factor for dyslipidemia. So that has been restored by the benfotiamine by upregulating the AKT phosphorylation and two downstream molecules, that is GSK and GS. In another study where they induced diabetes by streptozotocin in rat models, and they have given high dose thiamine therapy and assessed their beneficial effects. So first they have induced diabetes, thus diabetic rats, they developed dyslipidemia and also there was thiamine deficiency and increased advanced glycation end products. So at the end of therapy, this thiamine administration prevented the development of diabetic nephropathy and also it countered the diabetic dyslipidemia, and the major contributing mechanism is increasing the suppression of hepatic lipogenesis and reversing the insulin resistance. So based on these two studies, we can see that in diabetic dyslipidemia, the major risk factor for cardiovascular disease in diabetes, where benfotiamine can have a beneficial role. So thank you for your time. Thank you for listening.